I want to talk about the 5 things you can expect the day after your total knee replacement surgery. Now, this is going to be from a physical therapist perspective. My name's Tony Maritato. I'm a physical therapist, and I've been fortunate enough over a career of almost 20 years as a therapist to work with thousands of individuals who have had total knee replacements. Not only that, I have a Facebook group called the Total Knee Replacement Support Group for Kind People that has over 20,000 members. And it's a place where people can ask questions, get answers, hear stories from other people going through the same kind of challenges and struggles. So in this video, 5 topics. We're going to start with pain and discomfort. During the first day, really to 5 days, I say most patients will report the highest levels of pain, borderline discomfort. If your pain gets above a certain threshold to the point where it's really affecting your ability to move, it's affecting your ability to sleep, to concentrate, you know that you're getting grumpy, agitated, I really strongly would suggest you talk to your surgical team because you should not have that level of pain. If you do, they can make changes to your medication. They can make changes to positioning. They can do things that might help manage the pain better. Most patients will get to a point of discomfort that they can tolerate through the first 5 days. But if it's really painful, you need to consult your surgical team because we want to rule out blood clot, we want to rule out complications, and we want to find the right medication mix that's right for you. Your physical therapist will not be able to do that. It will be your surgical team. The second thing is going to be the swelling and the heaviness in the leg. A lot of patients won't even be able to lift the surgical leg. So lifting the leg to get into a bed or get into a recliner, lifting the leg to get in and out of a car, it feels almost impossible. And part of that is because the muscles of the thigh, the quadricep, the hip flexor, they are not functioning properly and they need to kind of wake up as you recover from surgery. So your physical therapist will help you wake that muscle up. There are also little tools and devices you can use like a leg lifter strap or things like that. But it's very common, very normal to feel that kind of heaviness from the swelling, the inhibition of the muscles to function properly, and the difficulty just getting that leg up when you're sitting, standing, moving around. Number 3 is absolutely, it is so hard to get a good night's sleep, and then the piling on of fatigue. It makes you, once again, have a short temper, a little bit irritable. Sometimes it leads to confusion. This is all normal after a knee replacement, especially the first day after, second day, third day. Usually it starts to get better by around day number 5, but just understand that even if you take little cat naps throughout the day, take the sleep when you can get it, because a lot of patients will report pain and discomfort increases at night, stiffness, soreness increases at night into the morning. So we want to focus and prioritize that best quality sleep that you can get. Limited mobility and the need for help. I think most people understand this, but nobody is really going to know until they're in the situation how much they can do. I can tell you after seeing thousands of patients literally 24 hours after surgery, some patients are walking in my clinic with a walker and I had no idea they even had knee surgery. Other patients are struggling to get out of the house. They can't get down the stairs. They can't get into the car. It is vastly different across different people, and it has nothing to do with what you were doing before surgery. Yes, there is some consistency that if somebody was active before surgery, moving around, walking, doing things, they might be doing that earlier in the recovery process. But I have seen very young, healthy individuals who had a knee replacement due to various traumatic injuries, and they really struggle to get around those first couple days. So if you can find somebody around to help you, absolutely take advantage of that. If you can plan your recovery team before you have the surgery, get all that stuff taken care of so you're not stressing out the day after surgery. And then finally, something that very few people talk about, but I think it affects everybody, is the emotional ups and downs, the emotional swings. It happens often that somebody comes into the clinic the day after surgery and they just break out into tears. There are people that get angry where they have a great disposition. There is no way, once again, to predict how you're going to handle the lack of sleep, the increasing discomfort into pain, the dependence you feel on the people around you. If you're normally an independent person and all of a sudden you have to have somebody help you get up to just go to the bathroom. This is a very emotional roller coaster. And it's important that one, you have people around you that you can trust, people that you know that even if you lose your temper, they're going to be okay because they understand what you're going through. And two, you have to give yourself a little grace. What would you do if it was somebody you cared about who is going through what you're going through now? My best guess is you would give them the grace, you would give them the empathy, you would give them what they needed to let them handle the emotions, and you wouldn't take offense to it. Do the same thing for yourself. Give yourself a little bit of freedom to have a breakdown every now and then. Do what you need to do to manage it, because you can't let that pressure cooker build up too much or it's just going to blow the top. So guys, those are the 5 things to expect after your total knee replacement surgery. The better you prepare for that, the better you're going to handle it. And we always want to hope for the best, but prepare for the worst. I wish you guys the best. I hope this video helped, and go look at my YouTube channel because I've got over 1,000 videos answering tons of questions from patients who have been in the position you're in right now. I wish you the best. I'll see you next time.